Unfortunately, in our state in the last year, my agency became aware of children, many children. I'm not talking about 3 or 4. I'm talking about 70, 80, 90 children in Oklahoma City metro area that were in getting their treatment for their brain disease and were not able to get education services at that time. They were falling behind in school, not only by weeks and months, but some by grades. Because when you have a serious, uncurable disease like mental illness, whether it's anxiety disorder, post-traumatic stress disorder, anything like that, major depression, the brain has taken years and years to become that way. So treatment takes sometimes weeks and months and years. And like me, who has a disease diagnosis myself, I have been in treatment with my counselor and medication for 14 years. It doesn't change overnight. It's not fast. It takes time for especially children to learn about their disease, to understand how to cope with the disease, the families to understand how to cope with the disease and what to do, the doctors to understand what treatment is appropriate for that child, because as you know, children's brains change very, very quickly. So these programs aren't fast. They take a long time. But during that process, we were finding at my agency that children were not being educated. Thus, they were falling behind their peers, which increases stress, anxiety, and the symptoms of their diseases.
My son, he was in Oklahoma City School Districts almost 2 years ago. We actually had to uproot our family and move because he was being allowed to sleep in the classrooms. He was brought into the new district into the 3rd grade, passed up by Oklahoma City saying he was in 3rd grade level, but he was actually tested out at a pre-K level. It doesn't just affect the kids, it affects the families. I have 2 other boys who have to help him to try to understand, you know, what he needs to learn. And it's something that everybody needs to understand is these kids need help. They need an education. If they don't get the education, they're not going to make it. We're trying everything we can, and we're just asking for help at this point. I tried, and Oklahoma City refused to help me, so I moved somewhere that did. And I'm grateful because my son is now up to almost on grade level where he is supposed to be within the matter of 2 years that he's been there. So I'm really grateful for that, but I really hope that the community does step up and understand that these kids need help. We speak for them every day, but we need help also. Thank you.
The answer by the district to me when I brought this issue up about this group of kids was just have them come back to school. We have counselors. Well, I mean, these are children that have been diagnosed with a very serious illness. Counselors aren't qualified to treat and administer drugs, do those kinds of things. It was just a completely out-of-touch comment. But if the parent's only option is to do that or treatment, they shouldn't have to be there. But if they go back to school the way they are, their treatment falls behind, they become perhaps a discipline issue in the school, which does affect the classroom environment. It affects that student, the other students, and the teacher. So this is not just some isolated incident, or it's not just something that affects these kids and their parents, but it affects a whole host of other people. And when your state's largest school district is behaving this way, it's astonishing, and it really ought to be a cause for outrage on behalf of a lot of people. And it raises the question in my mind, if they're doing it to this group of kids, what are they doing to other groups of kids that may be vulnerable? So I think it's a very serious issue when you have a school district that willfully and flagrantly ignores state law in the best interest of vulnerable children.
I'm advocating today and very happy to see that this House bill has gone through because it will enforce the fact that these children have the rights to public education regardless of where they reside at the time. We've known that for a very long time. It's been in the books for a very long time, but this only enforces that here in the state of Oklahoma because we all know education is so important, especially for these children that are incredibly, incredibly vulnerable. So what I would like to do is just make the public aware, especially families and providers that may be faced with this issue wherever you are, Oklahoma City, Tulsa, Lawton, anywhere in the state. Make sure that you understand that these children do have a right to a public education, and my agency, the National Alliance on Mental Illness, is there to support you, support your educators. We educate folks for free. We can help the families understand these diseases for free. And so this is something that your community can come together and we can make it happen for these children and families.